taking the patient's pulse. I've already done my general survey. First thing I want to do, of course, would be perform hand hygiene. After completing that, I approach the patient, ask for their name and date of birth. They affirm who they are. I then ask permission to take their pulse. Hi, is it okay if I take your pulse?
Yes.
So I do this by palpating. I'll be using the radial pulse by palpating the right area with 3 fingers, making sure not to use my thumb, because you can feel a pulse if you use your thumb. And I want to count for a total of 30 seconds if it's regular, 60 seconds if irregular. Since it feels regular, I'll count for 30 seconds and then multiply by 2. So it's been 30 seconds, and it was 30, so I multiplied that by 2, which means her pulse is 60 beats per minute, which is in line with normal. 60 to 100 beats per minute is normal, so you just made the mark. Forgot prior to this, I would first ask if the patient's comfortable. If they're warm, cold, beyond just asking if it's okay to take their pulse. So making sure the patient's nice and comfortable before you start doing any kind of assessment. Makes the patient trust you more, feel more comfortable working with you, more open to being honest with you. Just makes the environment a lot safer and more trustworthy for the patient. So since I assessed and I got a 60 beats per minute pulse, it's normal. I could check other pulses. You could do the apical pulse, the carotid. There's options of femoral and dorsalis pedis, but I chose to go with the radial. It's the least invasive in my opinion, and she obviously doesn't have any kind of barriers that would keep me from being able to assess that accurately. So making note of that, I would document 60 beats per minute, everything's normal. The pulse, since it was normal, it'd be a 2+. Moving forward, without stopping in a normal situation, I would keep my hands here, and without telling the patient, I would be assessing the patient's respiratory rate as well. You want to make sure to not let the patient know that you're assessing their respiratory rate, because once they know you're watching for how well they're breathing or how much they're breathing, it could actually change their respiratory rate. So you want to make sure you kind of do this in a sneaky way. And a good way is to just, while you're standing on the side, this is a good visual pathway to see chest rise and fall. If the patient's gown is really, it's like one of those extra large gowns, and there's a lot of, they're kind of baggy, and you can't obviously see inspiration and expiration. A good way to assess it is to lightly put your hand on the patient's back, and you can feel the chest rise and chest fall, inspiration and expiration, which I forgot to mention. Inspiration and expiration equals one breath. Again, you want to do this lightly, non-evasively. You still want to make sure that the patient doesn't know you're taking their respiratory rate. You want to make note of the rate. Normal would be anywhere from 12 to 20 breaths per minute. The depth, if it's labored or unlabored, and if it's regular or irregular, which would, if it were lower than 12 breaths per minute, they'd be Brady. If they were more than 20, they'd be tachy. So I'm watching for chest rise and chest fall. You want to do this for 30 seconds if it's a normal respiratory rate. If it's abnormal or irregular, you want to do it for 60 seconds. So I'm going to do it for 60 seconds. I'm sure I'm going to get better at doing this simultaneously as I take the pulse. Before you start taking this, it's a good way to comfort the patient. It's just, you don't want them talking while you're taking their respiratory rate. Obviously it could change. You just want smooth, steady, whatever their state is, normal respiration throughout the minute that you're assessing. So we're coming up on a minute. I counted 18 breaths, 18 full inspirations and expirations, which falls in line with normal. Perfect. Another way to do this, of course, is to use your stethoscope to auscultate. You want to put it, I find this really hard. This wouldn't be a good way because the patient, I think, would be more keen on that you're going beyond just the pulse. So figuring out how to do that is probably something I'm going to have to master. But we put this right over the chest. And again, you would do that for 30 seconds if it was regular, or 60 seconds if it was irregular or abnormal. Then you would document your findings, make sure the patient's okay. You doing okay?
Good.
Are you comfortable?
Yes.
Would you like a warm blanket?
No.
Okay.
Thank you.
Perfect.